I think we now know that the man had Ebola. It's no more a suspicion. Clinically, the clinical picture depicted a viral hemorrhagic fever. And carrying out testing, we were able to pick a filovirus because we are sure of the primers that we used. So only what we are waiting for is to find out which of the Ebola virus, which of the filoviruses. Is it Ebola virus? Is it Marburg virus? They are all equally deadly. So whichever way it is, we know the man is having a deadly viral infection. And from the brief history, we learned that the man collapsed while coming out of the flight.
Here in Nigeria?
Here in Nigeria, before being rushed on the wheel to a facility. So from that picture, the man had been incubating the virus. And only God knows how far the virus particles had gone in the organs and the systems. But the following day, when they now started looking at the picture, so they discovered that it was progressing. Because the second day of the admission, they noticed hematuria, they noticed diarrhea, and diarrhea coupled with hematuria, they are two bad signs. And these are the signs that have been associated with Ebola viral disease. This is a firm confirmation that we had the virus brought to us. And only God knows how far the thing has transmitted. Judging by the fact that the man was with other passengers in the flight. Only God knows how far they have gone in the country. Only God knows how much of virus they have exchanged through conversation, through greetings, while inside the Nigerian band flight. And mark you, there was a stopover in Lomé. From Monrovia, there was a stopover in Lomé before they got to Lagos. So only God knows how far the virus has transmitted. And at the airport, where we learned that the man collapsed, people rallied around to give a helping hand. So while doing that one, only God knows what has actually transpired. And that's why we need active case search and contact tracing. So that's what we need to do now.
This contact tracing, how difficult is it going to be? Because we're looking at a huge number of people here.
Yes.
Take, for instance, the people who helped him at the airport when he collapsed.
Okay.
You know, you just mentioned the people he must have met and probably shook hands with and played with right inside the aircraft. How difficult is it going to be?
It's very difficult. And that's why the epidemiologists are trained to use the mechanical approach. So there are ways by which you go about it. First of all, we need information. So about how the man came into the country. So we need information as to the manifest. We need information as to the seating arrangement in the flight. And then from the interactions of the crew, they should be able to give us a likely picture of what transpired while they were on board. And the people at the scene of the collapse, so they should be able to tell us who participated in rescuing this patient. And from there, we start picking information. So we start picking information, we ask them. Since then, we hope if not been having any uncomfortable feelings, we've not been having fever or so we will start asking them. Once you feel any uncomfortable picture within yourself, then let the hospitals know.
So are all of this been done now?
That's what we are planning now. The teams are planning that. As at yesterday, there is the establishment of the Infectious Management Center, being headed by the Permanent Secretary, Minister of Health, Lagos State. So we've swept into action. So we've been making contacts. We now have information about the manifest. We have information about who and who were around. So as I'm talking, our teams are in the facility. So where they've trained the staff, and then they now asking questions about those that were closely in contact with the patient. So we don't have to waste time, because so that we could nip it in the bud. So we don't want the things to spread. So, and we need to alert the whole nation to be aware that we've had this in Lagos. And once in Lagos, only God knows how far all those people might have been within the last couple of days. So all we need is just health education, all health facilities, be on the lookout, looking for the clinical pictures. So, and then the jingles have been running to wake up Nigerians. So we are trying to put things in place. So I will say that at least we are in control.
Do we have facilities in this country to deal with this virus?
Facilities in terms of detection, if it is detection, we have that, and that's what we put in place. So we were able to detect under 5-6 hours of receiving the specimens. We were able to make a preliminary diagnosis, and that's the type of thing we need. So once we make the diagnosis, and then we now follow up with management, and that's what we are doing now. We're managing the crisis. So as for detection, we have all that it takes to detect very early.
If this was to happen on a large scale, do you think in Nigeria here, our health facilities will be able to cope?
That's what we are trying to prevent. There's nowhere in the whole world that we say that health facilities will be handling thousands of cases at a time. There's nowhere, because we have a limit of bed space. And we are talking of cases for isolation. Cases for isolations. At most, our isolations cannot take beyond 40. At most, where we have it in Urua. If at all it can take that. At most. So we don't pray for mass outbreak. We don't pray for that. And that's why we are trying to make sure we reach out to people, we educate people in the healthcare facilities to know their roles. So we're trying to prevent mass spread.